Oh, wonderful. It's my pleasure now to introduce Stacy Gomes, who is a collaborative board member and education working group member, who is going to give us a presentation about best practices of interprofessional education. So welcome, Stacy.
Hi, great. Thank you, Beth. I think I know everybody on the call. If not, I'll just introduce myself real quick. My name is Stacy Gomes. I'm Vice President of Academic Affairs at Pacific College of Oriental Medicine in San Diego, but I work at all three campuses, San Diego, Chicago, New York. I am, as Beth said, on the board for the Collaborative and the Executive Committee and have been involved with the Education Working Group quite a bit over the years, but have been really busy the past year or two, so I haven't been able to be at all the meetings. My initial interest in actually the collaborative was the first very draft competencies that John worked on almost, I want to say 9 or 10 years ago. And they caught my eye, and I emailed him and I said, you know, you might want to edit these just a little bit. And he's like, well, then you should get involved, you know, John. So I did, and jumped in and started editing the competencies, and it's just been a progressive application of those competencies in many different areas, which has led to this presentation that I'm doing in Vegas at the International Research Congress for Integrative Health and Medicine and Health. So I don't know how many of you guys are going to that. Anybody?
I'll be there.
Yeah, Dale, you'll be there?
Yep.
Good. Anybody else?
I'll be there, one of the guests.
Who was that?
Gina, I'm one of the guests.
Oh, okay, Gina, yes. Oh, good. I just Googled you and added you on my LinkedIn. Good. I'll look forward to meeting you. I work with John Grinch a lot on a lot of different projects, so this will be particularly interesting to you. And I really want your guys' feedback, because this workshop that I developed for the Congress is with Liza, Ben Kligler from the consortium, and our academic dean from New York, Bo Anderson, who is, I believe, the chair of the clinic working group now, co-chair, and did a lot of several different projects with Ben and Beth Israel, which I'll introduce here, but she'll talk about more in Vegas. And so the purpose today, which I'm really excited that Beth actually encouraged me to present this, is because she said she didn't even realize that we were presenting at the Congress. And so, because I don't want to say I threw it together, but I did talk to Ben and Liza about it for a couple months, and then as the deadline approached, I put our abstract together and submitted it, and it wasn't, I think we talked about it on a board meeting and maybe at a general meeting, Beth, after the fact, right?
Right.
Can you guys hear me?
Yeah, you're doing great, Stacy.
Okay, so this particular slide set that you're going to see today is not the slide set that I'm going to be showing in Vegas. It's really for you guys, my colleagues here in back on what I might add or take away, and really understand the purpose of sharing the work that we're doing with other healthcare providers, because honestly, I'm not really sure who's going to be in the workshop. I'm thinking it's going to be mostly medical doctors, but I don't know. So, so let's just go through the slides and see what kind of feedback you guys have for me. I don't think I have control of this, so
right.
Who does?
I do. Yeah.
You do that? Okay, perfect.
And
let's go.
I'll just remind you, Stacy, that there is a short time lag. So if you've asked me to advance, I really have as soon as you ask me, but it might take a couple of seconds to show up.
Perfect. I think there's only about 8 or 9 slides in here. So, okay, purpose of the workshop. The presentation of the collaborative work within programs, institutions, and organizations. They will include student to student, faculty to faculty, clinic to clinic, institution to institution, and organization to organization. And I really set it out like that because so many of our institutions are doing multiple phases of IPE. And I think it's important for institutions, administrators to understand the different levels that we collaborate and how we might actually capitalize and magnify and share these different levels, because we're not all doing all of them, but we can do some of them, and some of them we can do better than others. Okay, so I also want to present the student competencies for IPE, which is the collaborative of our competencies, discuss some of the barriers to implementation, and discuss some of the critical elements to successful implementation. And what's really important, which I'm adding based on a recent article, is the discussion of the impact of IPE on the triple aim. So I have this article, which I didn't give you guys. I don't know if you can see it. It's called Interprofessional Education, What's Now and What's Next. It's in the Journal of Interprofessional Education and Practice, and it's all about the triple aim and how we've put all this work into IPE, IPC, and are we really hitting the bottom line? So it's a great discussion to close with at the conference. So that is kind of the purpose of really sharing this with other colleagues to see who's doing it and who's really paying attention to it.
Stacy, I had a question about the first bullet point. Did you want to include some of the other, like we have institution to organization? For example, we did a lot of the PEERS project, the Project for Interinstitutional Education Relationships, does talk about, so I don't know if that's something you wanted to add to that. But we do have, we do have some of our academic institutions working with healthcare hospital organizations.
This is great because as I build the slide set out with Liza, because she's going to have a lot of stuff on the IOM too, and with Bo and Ben's slides also, there's so many things we could talk about, and I'm really kind of picking and choosing how many slides, and once I look at their stuff, how to condense it down, because we do have a lot to share, and I do love that PEERS project.
Yes.
So thanks for that.
Sure. Sure. Shall I
next slide.
Okay.
Yeah, next slide. Let's see.
Got it.
Okay, so the learning objectives for the day of the workshop will be awareness of the Liaison Committee on Medical Education Formalized Standard ED 19A. Number 2, awareness of the Academic Collaborative for Integrative Health Competencies for Optimal Practice in Integrative Environments. So I'll provide the handouts of our competencies. You guys know what those are, but a lot of people probably don't. So I'll be bringing those. Number 3, recognize multiple models for interprofessional education, and we'll be presenting that and maybe even providing hard copies of what we can provide the day of. Number 4, identify opportunities for interprofessional education within your organization. And this is where we'll go through many of the different sample examples and talk about what you could do at your particular institution. And then this 5th one, complete an interprofessional education assessment. I'm pretty excited about this actually, and I actually have 3 really cool instruments for institutions, teams, and students to actually assess their level of interprofessional education. So one of them I'm sharing with you today. I think I put a screenshot on it towards the end. But that's going to be really cool stuff that people I think are going to want. So go ahead and advance, Beth.
Okay, and Deb had just sent out a message that, as a reminder, that the collaborative will also be having an exhibit table. So Stacy, if there's some things that you also want to have us, or we may also have on our exhibit table, so you can either leave things there that you want to share or refer to it during the presentations. Deb, did you want to say anything else about that?
Sorry, I was on mute.
Okay.
No, that's all. We'll have that there, and if there's anything else that you think we should bring, we're bringing a bunch of our stuff, but we will have it available on the table too, so you can always reference to that, and have our CEDR there as well. So.
Oh, good. Hey, do we have a new logo too?
Not yet.
Not yet. No, I wanted to put it on the slide set. So, do you think that'll be done before?
We do have a slide template. It doesn't have our logo, but it's got our colors and our organization. So I will send that to you, Stacy, right after this call.
Okay. Cool. I'd rather have that than PCOM down there. Okay, so this is the, this happens to be the LCME standard. Well, it's element 719 since they've changed their languaging from standards to elements. Now, the funny thing about this particular language within the standards/elements of the LCME is this has really been in the LCME language for a while for mainstream medical schools. And it's funny, Beth, because you sent us that link yesterday about accreditation and IPE. Remember that?
Right. Yeah.
So that's the IOM webinar. So I happened to listen to it this morning, and definitely have some ideas of how to incorporate some of that thinking. I mean, I could talk a lot just about this in general because one of my areas of expertise is higher education accreditation. And in this particular, we're seeing a very explicit inclusion within all of the accrediting bodies for medical schools for language on IPE, IPC. Now, it remains to be seen if teams will actually be mindful of this when they're on site visits. Me as a site visitor on several different accrediting bodies, it's not usually at the top of our list for things that we're looking for. So, I mean, that tends to be the hammer in most of our institutions is when site visitors come through and we get dinged on a certain area and we have to pay attention to something in more detail. And so it remains to be seen whether this actually evolves into a more significant role within healthcare education. The other thing about this standard is it has been around for a while, and my work with UCSD Center for Integrative Medicine, we've talked about this several times, and they said, oh, you know, that's been in the standards forever, and that just means, you know, that we're working with the pharmacists and the social workers, and I said, well, no, not really. This is really more about other healthcare professions also, and more about integrative and complementary alternative medicine. And, you know, Dr. Kallenberg looked at me like, okay, but we've been doing this for a while. And, you know, so you might, and we see this at the IOM, I mean, Liza and John have talked about it, that people in mainstream medical education think they're doing this. Mm-hmm. Yeah. So it's just a reminder that this is in the standards. I wanted to actually, maybe I should include that, the old language versus the new language and how this has been modified. I don't know that people will really care, but anyways, that's one of them, and we're seeing many of them. I didn't want to include all of the accrediting language because that would just be pages of PowerPoint. Sure. Yeah. Okay. Let's
hey, Stacy, this is Nicole.
Hey, Nicole.
I'm just interrupting you, but since you said you didn't know and you wanted feedback, I think that having both pieces, old and new language, might be really helpful.
Mm-hmm. That's a good idea. I know I kept debating on that. Yeah, let me make a note of that.
And I think it's also very interesting to point out that it says include health professionals from other disciplines, and what do they think of as, you know, they're doing the job when they include certain other disciplines, but they're leaving out a lot of others, and this is an old conversation for us, but not necessarily an old conversation for people who aren't including our professions.
Yeah, it's true. So, okay, so next slide.
Before I advance, just a formatting thing, you need to close the quotation marks. Yeah, I think, unless you did that on purpose.
Oh, good point,
yeah.
Good point. Uh-huh.
Okay.
Yeah, I'm going to edit that slide too with pre and post language. Thanks, Nicole. Okay, so what do we have here? So this is the link for the webinar that you sent yesterday.
I'm glad you got that on there already.
I stuck it in there as kind of a thought, like, do I want to include this for attendees? Like, I just don't know who's going to really be in the audience and who might care more about this.
Yeah, it doesn't hurt to keep it in the
yeah,
slides.
It doesn't hurt to include it, for sure. Next slide. Let's see. And so then moving into the competencies, probably most of the people in the room have never seen our competencies.
Mm.
And so I will bring hard copies of this document. And this is when I was thinking of changing the actual logo.
Mm-hmm.
I don't know if we're going to have them printed and ready for...
Deb, do you know if Renee is going to be making these new or if we're using old ones? Because it does have our old name on it. And it has John Weeks as executive director.
Yeah. Actually, I had spoken with Liza about that because I'm the one putting these together, and I need to talk with Renee on getting that. You know, we have so many of them that are printed already, though. But it would be good to update that.
Have that updated, Deb.
Okay.
If we can do it.
We have like a temporary logo that's on our website that I've been playing with. And maybe we can try to rip that off there and then update the executive director title as well.
And maybe we can, that would be great, Deb, and maybe we can just put some of the old ones on the table, you know, because we don't want to waste, but the new ones, we're personally giving them out to people. Something like that. Okay, so Deb will keep us updated. Thank you.
Thanks. Okay, what's next here? So these were just 6 models that I just pulled from based on the stuff I've been working with, but there's, I mean, this could be modified to so many different ways, like Beth said, adding the institution, organization, the peers. So I'll just start at the top, and Liza had wanted to kick it off with the IOM Collaborative Global Forum on Innovation in Health Professional Education. I haven't seen her slides yet, but she wanted to start there from a national level of our work with the IOM and what we're doing. And I may move these around a little bit too. So then we have PCOM and UCSD Center for Integrative Medicine. That is really clinical work, student to student, and actually we have shared faculty too that do teach at both institutions back and forth, and then board appointments also. So those are 3 different things to talk about within organizations. Then we have the PCOM SCRIPT, Center for Integrative Medicine, sharing faculty for conferences and hiring alumni and helping actually write languaging for them for hiring, things like that. PCOM and Albert Einstein. So this is the project with Ben, and I believe that this has been shared several times within ACAC. Bo's paper on the exchange and the different levels that we work with Einstein, with faculty appointments, board appointments, research projects, and the student exchange, how they do some labs together, and then they do shared clinic, they follow each other. So that one's pretty cool. And then the next one we have ACAC, this is the consortium and the collaborative with the HRSA, National Center for Integrative Primary Care. So this is organization to organization, where we used our competencies to help write the new curriculum for primary care, which is being housed at U of A. So I don't know if everybody knows about that, but it's definitely worth sharing how 2 organizations came together to work on that. I think several of us were on that project. I can't remember who. It's been a while. And then this last bullet, the collaborative, and AIHM. Okay, so that's the work that we did, again, organization to organization, development of the fellowship program, again, using our competencies. And then more recently, the development of the Student Alliance. So this is a student-to-student opportunity where the two PCOM student council members work with Danny Friedland to actually create a student alliance with Bastyr, UCSD, and SDSU PT, and then now they're taking it nationwide. So this is a pretty cool project too, using competencies for interprofessional collaboration. So these were just 6 samples of different ways that institutions and organizations can hit on some of the different ways that we can work together. And I think many of us are doing a lot of these kind of things, but when you get down into the weeds of how do you actually roll this stuff out, that's where some of I think the instruments help. So let's see what the next slide is.
Stacy, I have a question here. When you say 6 models, I'm a little confused on whether you're talking strictly about models of using the competencies or models of collaboration or elements of both.
I know, I thought about that too.
Yeah, so what are we talking about here? Are these all examples of actually using the competencies?
Yeah, they are. I mean, really, that's a very good point, because every single one of these projects has either used them or applies them in one way or the other. It's not as explicit as it could be, and I think that's part of the discussion.
Do they use the competencies deliberately, or are you just saying, hey, look it, they didn't know they were doing this, but they used the competencies?
Both. And that's what had dawned on me when I actually wrote up this workshop. I thought, this is interesting. Many of us are actually, we're intentional with really picking the competencies that we thought are most applicable for this particular class, program, institution, clinic, whatever it was. And then many of us really looked at them after the fact and went, oh, wow, we're actually doing some of these things.
Yeah, I think that'd be an interesting point to distinguish.
I think it is.
And the other thing is, I think you should, if you're going to keep the levels that you had in the first slide of student to student, faculty to faculty, then I would recommend explicitly saying, you know, there's the models show that sometimes people use the competencies deliberately and sometimes they use them after the fact. You know, I wonder if they even sometimes don't even know that they're using the competencies, but that's discussion.
I think that excuse me. I think that that's actually probably accurate. That people are doing these really impressive, and that's probably a lot of the discussion that's going to happen at the end. Is we're doing a lot of these very impressive collaborations. Can we be more intentional with the competencies that have been very mindfully created by IPEC and ACAT Collaborative, and really be much more explicit about their inclusion and awareness amongst stakeholders? Because this is the conversation I had with Danny Freeland at AHM and the students that were creating the Student Alliance, is that they should have actually brought the competencies to their very first meeting. I think it was last month at UCSD, and really discussed this. They missed an opportunity to highlight the significant work of collaboration that many people have been working on for years, and that their group is really underlining with their work together. So I think that's part of the discussion.
I think that's the richest part of the discussion, Stacy, because then you're going to have audience members reflecting that they are actually using the competencies and they didn't know it, and then they can let you know. So the two comments that I'll make, and then I'll stop, is to consider actually referencing the same labels that you used in the first slide. So show where you have student to student, show where you have faculty to faculty. If you're going to use those labels, then demonstrate them here. And the second is, I will send you the peers report, and you might want to just have those available, either put them on a slide or just know them that we have these other 8 models.
Yeah, that would be great. Okay. Thank you for that, because that was kind of a disconnect for me when I was putting this together, and I think it's actually important to consider the different levels: student to student, clinic to clinic, faculty to faculty, all these different institutions. I think it's important to have that framework in your mind, so that we can all, as institutions, administrators, go through this and say, okay, we are doing this at such and such a level, and really call it out.
Yeah.
I think.
Okay.
Yeah. Okay, let's see what the next slide is.
Got it.
Okay, so opportunities, starting small, building trust. So a lot of schools, they ask me, how do I start? How do we do this? And the first thing I say is you just have to build trust. It takes years to build trust. You do shared events with institutions. I mean, we do I don't know. It could be a shared guest lecture at both institutions, or a shared clinical night, like we do free clinics, or exposure to therapies on, certain, like, what is it, International Integrative Medicine Day, things like that. And a lot of people don't realize that that's, a starting point of just building a relationship with another institution. And then student to student. So, sharing classes and sharing clinic are two different things. And Gina, I have talked to John Scringe about this quite a bit, how SCU and at your institution too, we have massage students, acupuncture students, ND or chiropractic, doing clinical work or programs together, and we're maybe not as effective at combining their classes and their clinic learning opportunities as we could be. And it's right here in our own backyard. So how can we be better at that as already institutions? It's a question that I just kind of put out there for us to think about. So we even have massage clinic here. We have massage and acupuncture. And when I ask our clinic director, how are these two clinics, faculty and students working together and collaborating, and he kind of looked at me with a blank look on his face. I thought, oh, this is not good. So the shared classes, I know at Einstein and New York, the students do their anatomy labs together. So they're doing cadaver labs. And then the Einstein students come over to PCOM to follow the acupuncture students. So simple things. It's not, a full semester. It's maybe 1 day or 2 days, starting small. So faculty to faculty.
Stacy,
probably the easy.
I just want to give you a quick time check that we have 5 more minutes to the hour.
Okay. So the guest lectures, that's an easy thing that we can always do is share guest lectures, and we should constantly look for opportunities for that. Shared research projects, committee work. We need to be thinking about more of this faculty to faculty stuff. Institution to institution faculty appointments, and then shared board appointments. Okay, you can forward through this. Let's see here. Next slide, Beth. Okay. Okay, so I talked about that. That's the new student-to-student opportunity. Next slide. So this is the instrument that I think is the most useful from an administrative institutional perspective, because it really goes through areas where, as an institution, you should be thinking about courses, clinical rotations, community projects, service learning, standardized assessments, extracurricular activities, it's personnel, it's interesting, policies, things like that. I think that we need to be really thinking about, like, what are we doing with some of these areas. Then there's 2 other instruments that I found. One is for a student self-assessment, and the other one is for teams, if you have IPE teams, so they can do a self-assessment. That happens to be the first one that I mentioned. But I will make all these available to you guys and at the workshop. So I think that's it, Beth. Yeah.
Wow, that's wonderful. Thank you.
It's a lot of stuff, and I'm at the beginning phases of, like, putting all of our stuff together and trying to figure out how much time we have there.
Yeah.
To make sure that we cover what the most important stuff is.
Well, I'm so
any
glad.
Feedback.
So yeah, I'm glad you made this presentation to us today. Does anybody have any feedback that they want to give Stacy right now? And of course, feel free to email afterwards. Stacy would really appreciate it. But for right now, let's just open up and hear what people have to say.
Really fantastic work, Stacy. Thank you so much for representing the collaborative so well. This is great.
Yeah, fine. Camera off.
Any other comments, feedback?
Well, I'll just second Dale. This is Dawn. Oh, sorry, and just appreciate very much that presentation. Would you be able to make available the assessment to us?
Absolutely.
Or
Yeah.
Yeah, that'd be great. I'd love to see.
I have them all, and I wasn't sure where to put them for this morning, just so you guys could look at them. But I can certainly just email them to the whole group that that Beth sent out for the reminder.
Yeah, that'd be great.
Yeah, that would be great. Mm-hmm. And this is Beth. Don anticipated my question. I just want to say thank you, Stacy, and I look forward to hearing this in person and having a fruitful discussion, hopefully after your session with other human beings in the same room. That'll be such a privilege.
Thank you. I think there's a lot of opportunities for really increasing awareness and thinking about what are we really doing with this IPE, IPC stuff. We put a lot of work into this as organizations and institutions. And my bigger question is like, are we really impacting the triple aim? When we really think about that, which I didn't get a slide to, because I really have to think about that in the context of the article that was written, this is the bigger question. Great, we've done all this work, we're working together really well, but are we impacting healthcare? In what ways, how? How are we measuring it? How do we know? So that should be a fun discussion.
Have you done some looking on the nexus for that, Stacy? Because I have done a little, and I will again. That's what they're aiming for too.
No, I would love to talk to you more about that.
Yeah.
I'm going to share this article with you from the editor of the Journal for Interprofessional Education and Practice.
Yeah.
And this was from, oh gosh, what was the date of this one? It's 2015, October 2015, and he wrote his editorial on, that the fact that we're doing all this work, but, how are we measuring this for triple aim?
Yeah.
And that's the next kind of area that we have to focus on as healthcare educators.
Yeah. I'll take a look and let you know what I find.
Good, thank you.